was a cool case. It was pretty cool. So, how about this case? Like just off the
Ooh,
scab.
oh, there's like free air. Oh,
Well, there's like
there's
lucent,
tax. Yeah,
huh?
there's lucency. Yeah. Is that
Right.
free air?
Well, it's air, like in a
Mhm.
very funny kind of place.
Mhm.
Check this out.
Oh. Oh, wow.
So, so this is just like tremendous gastric pneumatosis, right?
Oh, wow. Yeah.
We found stomach is very distended, and
Yeah.
then you can see the duodenum is distended, and then kaboom, you have
Huh.
obstruction here, right?
Yeah.
So it's duodenal obstruction between the aorta and SMA,
Yeah.
and it has a name.
Nutcracker.
No, not
No.
Cracker. It right now. Cracker is for the left renal vein. This is SMA syndrome, but it's the
Oh.
same. It's the same idea, right? So when something is trapped
Yeah.
between the SMA and aorta. So this is SMA syndrome is actually very uncommon, and it's usually in people who either lose a lot of weight rapidly, so you're losing like this nice cushion around the SMA, or like sick, debilitated people, and
Mhm.
it's defined by just obstruction, right?
Mhm.
But this is an, the not the SMA syndrome leading to gastric ischemia,
Hmm.
also notice very nice portal venous air.
Wow.
See that?
Mhm. Mhm.
So right, so that was just a very sick patient with. I've seen a few cases of SMA syndrome, but I've never seen it causing gastric ischemia. But
What was the cause in this case? The patient had like rapid weight
um,
loss, you said, or
uh, well, a lot. This is a predisposing factor for patients
yeah,
when they lose a lot, rapid weight loss.
yeah.
This patient, let me see what the history was. Just dark brown emesis. Yeah, I don't think we have anything prior.
Yeah.
I think he has a colonic resection for. So I don't have any more history than what it has. It's and we have no prior studies, so
Yeah.
I'm not sure what else.
And the gastric like infarction is it from like venous infarction, just from hyperdistension of the stomach causing compression? Like, what
I
is it
mean
from?
it has to be right, but
Yeah.
it's so uncommon. Like
Yeah.
gastric ischemia is really uncommon,
Yeah.
and we did a case series and for gastric pneumatosis,
Yeah.
and vast majority of them they are associated with pneumatosis elsewhere in the small bowel,
Yeah.
and usually if it's just isolated gastric pneumatosis, it's not associated with ischemia. But this is an unusual case.
Hmm.
In that it's isolated gastric pneumatosis. It
Right.
is associated with ischemia, but it's because the stomach is obstructed. But it's very unusual, right? Because we see gastric outlet obstruction all the time. How often do they lead
Hmm.
to ischemia? So
Right. Must have been like going on for some time or something.
yeah, but it was a cool case.